Community. Community is a term that's near and dear to my heart. I'm sure you're all familiar with the word community and what it means. Communities have existed for centuries in the physical or offline world. And while I'm here to talk about online communities today, the word has been out there, and so there's probably a common understanding of what it means. However, just to make sure that we're all on the same page, I did some searches, went on Google, Wikipedia, and the general consensus or the shared characteristic or the characteristics were pretty much the same. People who are in a community or members of a community have a shared purpose or goal. They're accountable to each other. There's implicit trust. There's collaboration. And through all of that, they build bonds and relationships. And so we talk a lot about community at World One because we believe that physician communities will be an integral part in transforming global healthcare. Next. Yes. Can you hold it for a second? I was just going to say that this is a good example of when you have community, what you can do with it.
A discussion about practice management. I do want to start my own practice someday. Better follow this one and get back to it later. Time to check in with my residents. To be that young again.
Doctor, what do we do? The patient's in trouble! Huh? Oh.
Scratch that thought about being young again. All right, I better check up on those wrist x-rays. That new drug passed clinical trials. I just may have a patient interested in it. All right, let's see. The left wrist is visibly deformed. Looks like it has a distal radial fracture. This looks like it could be a Salter-Harris fracture. I wonder what the docs on Sermo will think. Let me take a picture. Specialty is orthopedics. Choose a question and post. All right, better get back to the office. My first eye consult response. Salter-Harris type 2 fracture. Just what I was thinking. I love this app. Now here's to a productive day.
Doctor, could you come take a look at this?
Or maybe not.
So that feature is called iConsult. It's on our mobile app, and doctors are using it to consult their colleagues in real time. And then these cases are available across the entire Sermo platform, on the web and on the mobile. And truly, there have been thousands of cases posted across many different clinical areas and diseases, and specialties, ranging from dermatology, pediatrics, pathology, radiology, cardiology, etc. In fact, I don't know if you can see the details in this toxicology report, but this particular individual is taking pretty much every narcotic known to mankind, tested positive for everything. Anyhow, hold on playing it for a second, please.
Hi, I'm Dr. Benjamin Lebreau. I'm the founder of Floating Doctors, a nonprofit medical relief team
this is
voyaging in an expedition vessel.
Can you hold it, please?
To provide healthcare to remote coastal communities in the Caribbean.
One of the most important parts of the Floating Doctors is empowering the community to take their own health into their own hands and better it themselves. So from training the fire department in first response all the way to educating a class about washing their hands, we really change and shape the overall health knowledge of that community.
Those are some of the things that really separate, I think, Floating Doctors: our mobility, our adaptability, the level at which we integrate and work within the community, and the variety of the types of interventions that we will undertake based on the different and unique needs in the communities that we see.
There's two main components of our project. One is delivering the immediate care that's needed within communities medically. The other is providing a sustainable chain and a sustainable supply for medical care and medical supplies within these communities. And we're able to do that by partnering to nonprofits that we're working with that can work in conjunction with each other once the southern wind has left that particular area.
So all I was going to say there is that when you have community, these are the types of organizations that want to work with you. This is a relief organization similar to Doctors Without Borders, and they're providing great patient care, very much needed patient care in developing countries. Here is an example of a post that Floating Doctors put on the Sermo website in real time to consult our community of over 200,000 physicians in the United States. They were actually very creative with this because Sermo today, this is going to change, but Sermo today is only available in the United States. And this particular patient was in Haiti. So they have a physician or physicians stationed in Florida. They share the details with that physician. They post on Sermo, and the physicians come to the poster's aid. As you can see, this post was initiated on April 2nd at 4:30 in the morning. Within 12 hours, the initiating physician, I don't know if you saw it on the previous slide, but this was marked solved on Sermo, which means the poster came back and said, the community helped me solve this patient's problem. In this particular case, the poster was worried about cancer. It turned out to be a lesion that was benign, but we have had many situations on Sermo where patients' cases have been solved. In fact, the youngest patient saved on Sermo was 5 weeks old. In total, tens of thousands of cases have been solved on Sermo, and this is underreported because it requires the physician who posted to go back into the post and say, I solved my case on Sermo. The average number of responses is 12, and it's by many different specialties in some cases, which speaks to the cross-disciplinary nature of many of these medical conditions. And at least in the United States, it's very difficult to get physicians in multiple specialties collaborating in real time together in the offline world. So there's a lot of value in that. But even more importantly than the number of responses is the time that it takes to solve these cases, because they are urgent. And so in the example that I showed you, there were only a few responses, but the case was solved. The average time to solve is 2 hours, and often in as little as 2 minutes. Why does it work? Why are our physicians responding at this kind of speed and coming to the aid of their colleagues? Because Sermo is a true community. Because there's that accountability there. Because there's that trust. Because in communities, you have that kind of responsiveness to your peers. Because Sermo is only for verified physicians, so you know if you're on Sermo, you are talking to one of your peers who has experience and expertise. Because Sermo is a crowdsource app, not a diagnostic tool. While the technology is cool, the real value comes from the experience of the physicians. And so this is not a class 2 device. Without the physicians, there's very little there. Sermo is an exchange, so if a physician responder, someone who comments, recommends a specific drug, there's no underlying motivation on the part of that physician. It's taken with sincerity and authenticity. And lastly, Sermo is open to all doctors. Granted in the United States today, but that will shortly change, but we're not bound by EMRs or geography.
Thank you.